موبايلي بيرن يا حمارة.
Hi, good afternoon. This is Varda Sayyed from the W blog. I am a blogger. Okay, can you hear me? Hi, this is Varda Sayyed from the W blog, and I'm here in Burjeel Dream Island branch here to discuss and to celebrate womanhood and oral health. We have two guest speakers here. The first one is Ms. Dina Al-Darwish, and the other one is Dr. Ryan. So we'll start with the woman nutritionist here, who is Ms. Dina. I would like to welcome her here. Let's hear what she has to tell us.
Hi. Yes. Yeah.
Please have a seat.
Thank you. Is it working?
Yeah, you need to just open it.
This way, like this? Yeah.
Yeah, it's working.
Yeah, hi.
Hi, Ms. Dina.
Hi, how are you?
How are you doing?
I'm good. What about you?
I'm doing good.
Yeah.
So tell us about the nutritional values. Sorry. Tell us about the nutritional values and, how is it important for womanhood and how they are important for women.
Yes. Well, my name is Dina Al-Darwish. I'm a clinical dietitian.
Yeah.
I usually cover nutrition-related medical problems and weight management.
Okay.
And today, I believe we're going to specify more about women-related health problems. And we're going to start as today's Mother's Day. Yeah.
Happy Mother's Day.
Thank you.
Okay, so should I ask some questions that I've prepared for you?
Yes, please.
Okay, so my first question would be how to maintain good women health with diet.
Well, we need to focus on the BMI.
Okay.
And by BMI, I mean the body mass index, which is the ratio between the weight over the height. Okay? We need to follow or keep it within the normal range, which is between 18.5 and 25 kilogram per meter square. And it's usually, if you want to reach this goal, it has to be by following a healthy, balanced diet, which should include all the macro and micronutrients. In addition, to keep your body in good health and to prevent it from any deficiencies, iron, from mineral or vitamin deficiencies. In addition, or the second tip, it can be to stay active and exercise. And by exercise, I don't really mean going to the gym. You can specify 20 to 30 minutes of walking daily. And the third tip is to stay hydrated. You need to drink plenty of water. 2 liters per day, because 60% of the body's weight is around is of water.
In the water, right.
Yes.
So we actually do not need to go, so we don't need to go to gym and to have that gym-philic experience to stay fit and to have nutrients.
Yes.
We can do everything at home as well,
Exactly.
right?
You just need to specify 30 minutes of walking, let me say.
30 minutes of walking is
Yes.
adequate. Oh,
Yeah.
That's great. And what's the most common deficiency in women?
Iron is the most common deficiency in women because women undergo menstrual cycle each month, and because women undergo menstrual cycle each month, and with each day of bleeding, they usually lose around 1.5 milligram of iron.
Okay.
So it's very important for them to keep an adequate iron intake. And moreover, in pregnancy, pregnant women usually need double the amount of iron than non-pregnant women. So pregnant women has to ensure daily intake of iron.
That's why we have to take so many supplements during pregnancy.
Yes.
Yeah.
And because iron deficiency anemia may lead to low birth weight and premature delivery.
Oh.
So let me say the recommended dietary allowance for the non-pregnant woman is 12 milligram per day. And for the pregnant woman, it's approximately 27 milligram per day.
Double the weight.
Double the amount, exactly.
Okay. And how can a woman know that she is going to be iron deficient?
She has to check for the deficiencies, the common deficiencies, which is usually like, let me say, pale skin, brittle nails, lightheadedness, dizziness, headache, tachycardia. Those are all the common symptoms, let me say. And we have specific diseases or disorders that can cause iron deficiency anemia, like Crohn's disease, celiac disease, ulcerative colitis, peptic ulcer, gastric ulcers. So patients with such diseases, they need to check for iron deficiency anemia.
Can we link hair fall with iron deficiency? Like normally it's somewhat that if you are losing hair, you must be iron deficient. Is it so?
It might be any other vitamin or mineral deficiency. It's not specifically iron, but it's one of the reasons.
One of the reasons can be.
Yes.
Okay. And what are the food sources through which we can get iron?
We have two types of iron sources. We have the heme iron and we have the non-heme iron. The heme iron is the easily absorbed by the body, which is usually from the animal-based sources, which is let me say poultry, chicken, red meat, seafood, and anything from animal-based. And we have the non-heme iron, which is the plant-based, which is, let me say, legumes, soybeans, tofu. Those are all the plant-based. But it's always advised to take the non-heme iron with a vitamin C source to enhance the absorption.
Okay.
And not to take it, to avoid it with the calcium sources because it blocks the absorption of iron in the body.
Oh, that's really good. So what is it difficult for a woman to lose weight?
Hormones are the major major weight loss problem for women.
This question is going to help a lot of mothers out there.
Mainly, for example, women with polycystic ovarian syndrome, which is known as PCOS, their weight loss rate is much lower than the women without polycystic ovarian syndrome. So it's very important for them to follow healthy, balanced diet, low in inflammatory foods, rich in whole foods, protein, fruits, fibers, healthy fats and proteins.
Okay.
And in addition to the lifestyle modification, they're exercising, ensuring adequate fluid intake, having regular sleeping pattern. It's also difficult for a woman who has reached menopause, which is the end stage of menstrual cycle.
Yeah.
It includes fluctuation in hormones, which can lead to increased fat storage. So it's a reason for not only it's hard for them to lose weight, but also it's reason for them to gain weight.
Oh, okay. So what's the normal weight gain for a pregnant woman?
It depends on the BMI, and we usually calculate the BMI using the pre-pregnancy weight, because we have using a scale from the body mass index. We have from underweight till obesity. Let me say from the normal range, which is between 18.5 and 25, it's usually around 11 to 16 kilogram extra on their ongoing weight, and should be distributed along to their 3 trimesters.
All right.
Yeah.
So anything else that you want to share with our audiences here about iron or the importance of iron or any other nutrient that a woman needs during the, her motherhood or being single or anything like you can share?
It's just very important for them to follow the balanced diet, as I mentioned earlier, for them to include all the macro and micronutrients, so we will not face any problem or nutrition related problems because of the deficiencies we're facing. So just have balanced diet, regular balanced diet, without following the starvation diet plans, cutting all carbohydrates, having all healthy fats, those frauds, let me say.
So that's not needed, guys. You need to eat healthy in order to stay healthy.
Exactly. Any questions?
So do we have any questions here from the audience? Luckily, your talk was very beneficial for everyone so that we don't have any more questions regarding this.
Thank you very much.
Now, I would request Sidral to please come on the stage and present a token of love to Ms. Dina.
شكرا.
سيدرون يا دكتور، مالتي فيتامين وايرون، تمام، في حاجات
شكرا. شكرا. Hi, Anki.
So I would now request Ms. Ryan to please come on stage and
Shall I remove this?
give us a brief about childcare and her thoughts about the motherhood. I'm not getting it. Let's have a small activity here. We have placed a spin wheel here, so you can try your luck and spin the wheel. Let's see what you can get out of it. Do we have any volunteer and anyone who want to participate? It's just spinning a wheel, come on. Oh, we have one here. Let's see what you're going to win. Just spin it. So Bioderma invented micellar water. It's all yours. Enjoy. Do we have anyone else here who want to spin the wheel? And let's see. Micellar water is in brown, I think. You want that as well. It's good. Congratulations. Thank you. We have one more. Please, no micellar water. Electric facial brush. Congratulations. Let's give it up for her. She won a different prize. Anyone else who wants to come and spin the wheel? Come, please. It's a tie. Can you spin it again? It's a Sensibio H2O. Congratulations. Anyone else who wants to come? We have some more goodie bags. We want to give it to you. Please come and claim. Anyone? Come, come, come. Please come. What are you thinking? It's free. It's not going to stop, I think. It's going back. Free pouch from Bioderma. Claim your gift. Congratulations. Wow. I hope you guys are enjoying the small talk and informative insights that our doctors are giving to you. So I would like you to please get a little active and ask questions that you are having in your mind, and you want to share it with our audience who are, you know what, our event is going live on Instagram, Facebook, and I think on YouTube as well, in case if you want to see yourself. Lamia, why don't you come here and spin the wheel? Why no? Yeah, please come. It's Bioderma micellar water for you. Please claim your gift. Thank you. Congratulations. You want to come? Please come. It's electric facial brush from Bioderma for you, Lamia. Congratulations. So we have two very important things from Bioderma here, which are their micellar water and electric facial brush. I think they are quite in run because everyone is spinning the wheel and they are getting this out of it. Anybody who wants to sing a song here just to light the environment, engage with you. So anyone who would like to come on stage and say a few things for us? Okay. It's all the listeners and the viewers who are watching us live. It's a very happy Mother's Day from me and from Virgil Hospital Al Reem. I hope you guys are getting sane day by day instead of getting insane with the little ones. Lamia, can you take my pictures too, please? Yes? It's fine. You can say in any language. Yeah. Arabic is fine. Please go ahead. Sorry? Yeah. Arabic is fine. Arabic is fine with us. Please go ahead. We have some listeners who understand Arabic here. Yeah. Lana is going to help me with this.
أقول حبيت أشارك في عيد الأم. كلهم عليه السلام. ما بعرف شو أقول. هني لي عندهم وكل سنة وأنتم طيبين أمهات وجعلهم سنة بخير وسعادة وأمانة أمي ورشيد وأمهاتي طيبين صحة يا رب. واللي عندهم يحافظ عليهم ويشوفها وايد يشوفها. لأن أنا عندهم أحبها وايد. الله يخليكم كلكم أمهاتكم يا رب ويحفظكم بكل خير يا رب. كل سنة طيبين يا رب. شكرا.
Thank you so much. You can give it to me. Thank you. Thank you. Yeah. So now we have our second guest speaker with us, Dr. Ryan, and I would like to invite her on the stage and let's hear what she has to tell us about childcare, because she is a pediatrician in Virginia Dream. So let's have a hand for Miss Ryan, Dr. Ryan.
Hello.
Hi.
Hi.
Good afternoon. How are you doing?
I'm good. Hello.
Please come have a seat and tell us something that you have to tell us.
This is not working.
You can have this one. Just take
Remove
off
the mask.
Yeah.
Hello. Good afternoon, everybody. I'm Dr. Rayan, and today I wanted to discuss a very common topic that we see in our clinic, which is baby eczema or eczema. And maybe I should say Happy Mother's Day for all the mothers to be.
Mic a little up. Mic a little up.
Huh?
Mic a little up because they are not hearing you.
Okay. And also I would like to say Happy Mother's Day to all the mothers. I think it's the hardest job out there. They are the doctor, the teacher, the nurse. It's also a hard day for some people, for people who have lost their mothers. And then so to remember to be considerate for all the people and wishing them a blessed day. Okay, so today we're going to talk about eczema. It's a medical condition that is caused by itching, red skin. It's actually diagnosed by, it's a clinical diagnosis. So if you want to diagnose it, there's no test to really diagnose this, it's clinical. It is actually a bad disease, so sometimes it can keep you from sleeping, it can keep you from carrying out your normal life, and for some children it causes a lot of embarrassment because aesthetically it's not nice to look at sometimes. Sorry.
So we have a few questions from our audience who would like to ask you, because eczema, you know, it has become a taboo in kids, and mothers get really scared when they see their young ones suffering from a disease that they are not aware of fully. So just tell us briefly, what is eczema?
So eczema is a type of dermatitis. Usually eczema is linked to allergy, but it's not necessarily linked to allergy. So there's always this question, does eczema cause allergy or does allergy cause eczema? Recent studies have been showing that eczema will be the cause of allergy because you have a broken skin barrier. It's a clinical diagnosis, usually by looking at the skin. It's red, it's inflamed, it's cracked, it's leathery, it's thick. Depending on the age of the child, it will be in different locations. Below a year, it will be on the face, on the outer extremities of the elbows and the knees, usually not on the diaper area. And older children, it will be on the flexures. So yeah.
Do we know the actual cause of eczema that can help many mothers out there who would be able to know that what exactly is causing eczema in their young ones?
So there's eczema is not caused by a certain thing, and it's not curable. So it's something that waxes and wanes. Eczema has a genetic component, so usually we check about allergy in the family, eczema in the family, hay fever, asthma in the family, and that gives a big idea. The second one is triggering factors. So there's many triggering factors that can cause eczema. So the climate conditions, certain detergents, certain soaps, etc.
Can we list any kind of allergies that are causing eczema in kids, in young ones? Because some babies develop this disease, and we are not aware of the allergy that they are allergen of.
So that's an interesting question. So in terms of eczema, like you said, that we don't know the exact cause. Sometimes it is and most children you'll see with severe eczema, they have had some dietary modifications, such as, for example, if eczema started below 6 months, the most common reason would be milk, because that's the most common one. Above 6 months, usually we would remove milk, soy, eggs, and nuts out of their diet. But then again, sometimes it's not contributed to a food allergen per se.
All right. And what is the treatment of eczema that you can prescribe to the mothers?
So the main treatment of eczema is trying to maintain the skin barrier. The skin barrier is maintained by moisturizing. Sometimes you might need immunosuppressant creams, such as steroids, to remove the inflammation. But the mainstay treatment is good skin care and preserving the skin barrier.
And how can we preserve that skin barrier in babies? Because their skin is already very moisturized. But the babies who are suffering from eczema, it's very dry and irritated skin. So how can we maintain that barrier?
Okay, so it's very important to note that when applying moisturizer, it's actually quantity. So usually a tube of 250 grams should be finished in a week. It's twice a day when your skin is normal, and then 3 times a day when your skin is inflamed. Minimum of 3 times a day, so the more the merrier. There's actually a certain way that you should always apply the cream, and it's quite important to note that it's always in the direction of the skin follicle. So it's in a downward motion, as a skin downward motion, rubbing as a skin following the skin follicle, because we don't want to clog the hair follicles. And usually using a whole scoopful, warming it in your hands before applying it on the skin is the best way.
So there is actually a myth, going on with eczema, associated with eczema, that people think that there is a certain way of taking bath or not to take bath while having eczema. So can you please tell us how to have a bath when you have eczema?
So yeah, that's a very important question. Most patients who have eczema tend to not to have a bath, where actually quite the contrary is true. You should have a daily bath, not too long, usually 10 minutes long, with lukewarm water, so not very hot water, not very cold water. So the reason is, if there's allergens or if there's infection on your skin, we need to wash that off. Also, keeping your skin damp is a good way to accept moisture. So a good way for children below 1 is always to moisturize the skin before taking a bath. So we would actually moisturize the skin with plentiful cream before taking a bath. Be careful because the baby will be slippery now because they're full of cream.
Yeah, that's what I was thinking.
So they'll be slippery, but be careful, put them in the bath. Adding oil to the bathtub is very important and not to the skin, because oil on dry skin can actually make the skin worse. And then when you have a bath, if they're less than 1, you don't actually need a soap or a shampoo. You can actually use the lotion to clean their body. Above a year, try to use a fragrance-free soft soap or shampoo. Usually what they say is, usually it would be written for eczema-prone children.
Skin, yeah. Okay. So, how to apply creams in eczema? You have discussed that the quantity should be adequate in case of eczema, but is there any specific kind of application that is to be needed on irritated skin?
So it's really important to know the way to apply the cream, because, for example, after a bath, rubbing the skin instead of patting it will make the skin more worse. It should be patted the skin. Applying the cream in a downwards motion, plentiful. Usually what I tell the patient is you should be able to write the name of the child with the skin, with the cream. So it should be all white. Now when you put the hydrocortisone or the immunosuppressant cream, a common question is, will it have side effects? If it's used on the inflamed skin, it won't have side effects. And then it should be a fingertip unit or a toothpaste unit to apply to 2 palms. So a fingertip unit for 2 palms. Also to note, there was one more thing I wanted to say. So also to note that also on the hydrocortisone cream, usually on the paper, because it's bought over the counter, it would say 5 to 7 days. However, with the guidance of a doctor, it can be used until the skin is back to normal, and it would be tapered off.
Is it ever be curable disease, eczema, or not?
So it's not really a curable disease, and it varies in symptoms, but most children outgrow it at 5 years old. Sometimes at puberty they might have another outbreak. Sometimes, for example, in pregnancy they can have another outbreak, so there is a hormonal component in it. In terms of, and then everyone has, like, some people have very mild disease, some people have very severe disease, so we can't really predict who's going to have a better outcome or not. There's another thing that should be mentioned here. Some people who have eczema will have something called the allergic march. So they'll start off with eczema and then it will turn into allergic rhinitis and asthma, and then we should always inform the patient to be careful and wary about this.
So how can we differentiate a common rash from eczema? Because a rash too lasts for 2 to 3 days if it is severe. But if it is not, then how can a layman mother can simply differentiate between a rash and eczema?
So eczema is not something acute. So usually from history taking, like we said, the environmental factors, the genetic factors, that's what helps us differentiating the history. Also looking at the skin and how it's inflamed, cracked, itchy. These all give us clues, the location also. In terms of eczema, there's many treatments that we haven't discussed, which is like vitamin D. Vitamin D has been proven to help with eczema. Another one is with severe eczema, we do discuss wet wraps. Phototherapy has also been discussed for severe eczema. So there's many new things coming out to help this dermatitis and eczema. Another thing to note is, I forgot what I was going to say.
That's fine. Happy Mother's Day. We all are mothers, and we know how forgetful we get when we have kids with us. So there is one more thing the last thing that I really want to ask is, normally when we, baby is suffering from eczema, and you said that it takes an age gap till 5 years of age, or if not, then at puberty it comes out again. So till 5 years of age, if a mother or a parent doesn't know about a common allergen or any symptoms associated with that, and they normally call it an irritation or a rash or anything, that they completely don't know about eczema. So how will you address them to look after the disease properly and to consult a doctor, a pediatrician or a skincare specialist to come over and have a look at how can they help with the kid?
So usually the general guidelines of someone with eczema would be how to maintain the skin barrier. Try not to make the patient very hot and sweaty, so always we avoid wool, we wear cotton, loose-fitting clothes. Of course, as we discussed before, moisturize. Even if there's no flare-up currently, we do moisturize. Also, humidity is good, so some children, we actually tell them to put a humidifier in the room because dryness and heat can make worse the eczema. Also, certain detergents can be hard and certain soaps can be hard, so we like to switch to sensitive detergents and sensitive fragrance-free shampoos and creams.
Thank you so much, Dr. Ryan. Now I would like to request Cetaphil to come on the stage and present a token of love to Dr. Ryan. If any one of you is having some questions to ask from Dr. Ryan, you are welcome to ask, please.
Thank you very much. Thank you. Thank you.
Any questions regarding eczema or any skin disease that you are having in your mind, you can ask away. So we had an insightful session here with Dr. Ryan, and I think we have covered almost all the areas or all the concerns regarding eczema here. Nobody is having any questions, Doctor. Okay. Thank you so much.
Thank you very much. Thank you.
Thank you so much for being with us and to listen to our talk. And I hope you guys are. You want to say something? Please.
To me?
You want to say ask something from doctor, or you want to say something general?
Oh, okay. Okay. You are.
Okay. Okay. It's not working. It's working? Just a little.
It's working now?
It's working. Just you need to hold it here. Please take this one. You can change it. You can have
No,
this.
it's working. أول حاجة الدين على تنظيم الفعاليات وكان بيوم مميز في السنة هو يوم عيد الأم، وحابة أشكر كمان مجموعة العزيزية الحلوة اللي بيعملوها، وكل سنة كل أم بخير وسعادة يا رب. Thank you.
Thank you so much. Thank you so much everyone for being with us. It was a pleasure being here and host this talk show or talk event here. I hope you guys had a good time with us. Have a good evening everyone. Thank you.